just before I finish, we have also added D-ribose. D-ribose is a sugar. It helps to make the product taste better. But did you know that D-ribose is a sugar that is specifically important to the heart? Okay, there are many things that are important for the heart. The microminerals, coenzyme Q10, many other products. But D-ribose, which is a very expensive kind of sugar, we have put in also. Okay, now that brings probably the next question into mind. Doctor, if it is sweet, can diabetics take it? Okay, if you take the product, you find that it's a little sourish, but there's a lot of sweetness in it. Now, we are so used to this. If it is sweet, calorie must be high. Okay, which is true. All the products. Now we have come to a stage where scientific studies have come out with products where there are sugars 300 times sweeter than sugar. So you can take something that is very sweet and hardly no calories. Now D-ribose is a natural sugar that is low in calorie, high in sweetness, and good for the heart. Okay? Now coming to the diabetic part. A diabetic is restricted not by sweetness, but by the number of calories in his diet. So he's on treatment, he's on a careful diet, he or she should not be taking more than 1,200 calories. Okay, if he's really strict, 1,000 calories. Some people cannot tahan, eat a bit more, 1,500. But ideally speaking, 1,000, 1,200 will be just nice. Okay, one dose of Vemma is 80 calories. So he can drink the whole bottle and you will not tip your blood sugar. Okay, no, don't recommend the whole bottle. No. Don't recommend the whole bottle. One dose. Now, sometimes people who are not that well, they need to top up their overdraft in the body. Which means, I would suggest, those who are starting quite weak, for a start, take two doses a day. One in the morning, one in the evening. Because we've got a lot of overdraft to fill up. Even then, we are talking about 160 calories, which is about 15% of the needs of a diabetic. Okay, so there is no fear at all. You can take this product. Okay, in short, if you want me to sum up, we have a product which is not equal in the market for all the population right from year 1 to year 90. Why? When you become 1 year old, you go on a normal diet. You're already on solid diet. You want the child to grow up well, give half a dose. This is food. It is supplement, but it is food. So, orang yang kecil akan lebih kurang sikit. Those who are bigger, more. So it's what we are suggesting, that single glass that is provided is a suggested serving. It's not dose. Dose you talk about only in drugs. 1 tablet 3 times a day before meals, so on. This is not like that. You can take it anytime. Okay? Suggested serving. Okay? Now, when it comes to old people, you can take 1 or 2 doses a day. Separate it out, space it out. Absorption is better. Okay? It is liquid, so nobody can say, I can't take it. I see patients in the clinic, 9 years old, cannot swallow tablet. 7 years old, cannot swallow tablet. Give one big burger like that, but kating gigit habis. That can swallow. 1 tablet cannot swallow. Now, you will not face that problem because it's liquid. Okay? Expectant mothers, be careful. This is very, very helpful for expectant mothers. But expectant mothers today and their gynecologists are very protective. Okay? This is a product you can give to expectant mothers, show to your gynecologist and ask them, because this is absolutely helpful for them. They can take. But if they don't want to take, don't force them, because that's the time. You're not your product. There's so many other risk factors. If anything goes wrong because of something else, they will say this is the thing that caused it. So avoid it. For cancer patients, excellent. they are doing many other things, treatment la, prayers, cleansing, they are taking vegetable juice. This will be an added tool for them. So you can give this almost to anybody. What about kidney patients who are on dialysis? Now, when you do dialysis, not only the urea and uric acid comes out, minerals also go out. You look at the patient on dialysis, they look very weak. Not because they are on dialysis, because they lose minerals. This is very good. But again, that is a case where it's better to show the doctor. And we have nothing to hide. It's all on the bottle. Okay? So you can boldly tell them, take this, you will feel better. Okay? One last question. Many people say, hey, this is plastic bottle. Doctor, you also say plastic bottle no good. No? How come this is a plastic bottle? I have a friend who markets flask, water flask, made from clay. Beautiful to look at. I said, hey, can you give me one? He said, no, doctor, not for you. Why? I myself have broken two already. A little bit slip, boom, gone. $60 gone. Okay? So, plastic bottle, number one, it doesn't break. It can fall down, you know. Number two, plastic now is of a very high grade. We know enough to make plastic bottles that are of high grade. It's called food grade. So no matter what you put inside, it doesn't leach chemicals from the plastics. This belongs to that class of plastics. And in fact, it's even one grade higher than that. So I would suggest, after you finish the product, you can use it for keeping water, to take it around when you're traveling. It's also another form of advertisement of Vemma. You may be drinking water. So the container is basically there so that you get the best plastic bottle, because we have so many good things inside. It should not leach anything, and that's why the quality of the bottle is so much better. And by the way, this plastic bottle is costlier than glass bottle. Costlier than glass bottle. Okay?
Recycle is lousy plastic.
Now, I think I've said all that I've said. Should I take some questions? Huh? Are there any questions that you would like to ask? I will try and give...
in DM also can. They also don't know. Huh?
Yes, at the back. Can we use the Vemma solution for external application? Sorry? Okay. Can you use it? Yes. But that's a very expensive product to use for external uses. Okay? There are other things that are cheaper that will work equally well. So let Vemma product work from the inside. Does it help in healing wounds? Of course. When you get injured, free radical activity goes up. So when you take it inside, it helps from the inside from healing. Use less costly stuff outside. Cleopatra used to bathe in donkey's milk. Now they find that if you take milk powder, put it into a cloth, soak in water and just rub your body, you get the same effect. So that's a very costly way of doing it. Good, but costly way of doing it. Any other question? Yes.
Doctor, I have a sister with a diabetic problem. Okay, before she took Vemma, the sugar level stayed at 16. 16. But after 1 week, she took the Vemma, and then the sugar level rise up to 20 something. But the fantastic thing, she doesn't feel anything. But definitely, when we go to doctor and check the level going up, we feel something is wrong somewhere. So why is this happen?
Someone has diabetes. The level was 1.6 before taking the product. After taking the product, went up to 2.0. That's right?
Yeah.
Okay. Now, 1.6 is already very high. You should not go beyond 6 to about 9. 6 and below should be on an empty stomach, up to 9, maybe 2 hours after a meal. That's the range. So anything more is not good for the body. 16 is very high. If 16 is high, that means the patient is not being treated correctly, or the patient is taking food that he or she should not be taking. One of the two. Because treatment is by diet and medicine, not just medicine. Okay? Now, someone who has been 16, 14, 15, somewhere around there, they will be in quite poor health. Okay? Now, the moment you take a product that boosts your health, one of the things that goes up is your appetite. Okay? So, you have to tell them that this product is not a cure for diabetes, because some people falsely in their mind might think, this is going to help me with my sugar, so now I can eat what I want. And that's what usually happens. They don't tell you that, but they expect that to happen. Okay? So if they are 16, I would suggest they have to be reviewed by the doctor to further adjust the medicine and the diet. While doing that, start on the product. So the product is to improve your health so that the body can control the diabetes. But it is not in place of medication or diet. Like I mentioned earlier, the calorie count is so low, it will not contribute to that increase. It must be a higher increase in consumption or something like that.
Any question? Siti? Any question? Sayang.
Yes.
How if the can the person who take warfarin every day drink Vemma? Because warfarin patient instead of to take warfarin every day, they are encouraged to take green tea. Tapi Vemma, can they take Vemma?
Okay. Now, there are some people who have heart problems, stroke problems, and there are one or two other problems where you have to take a medication to thin your blood. Warfarin is one of those products. So you're on a product to thin your blood. Can you take Vemma? Absolutely. Now, those who take products for thinning of blood are told, don't take certain vegetables. But then we have extracts from vegetables. Can we take them? Now, what they're talking about is certain enzymes from those vegetables. Those enzymes are not found in our product. We are not extracts of vegetables. We are mineral extracts from vegetables. Okay? So someone, I assume, some heart problem or circulation problem, the patient.
Okay. I've got one sister-in-law with
Ah,
heart problem.
heart problem.
She got mechanical heart problem.
Okay. Someone with a mechanical heart problem, which means the beating is not regular. So some of them have to put a pacemaker and so on. Which means the nerve conducting the heart rate is not working that well. For nerves to function well, you need a lot of microminerals, which this one supplies in a definite form, easily absorbable form. In fact, I would encourage that person to take it. Now, don't push too hard. Maybe start with just half to gain their confidence, just half a glass. And as they get better, let them, and I'm sure they're going for a checkup. So as they do their checkup, they will see their bleeding time and all that, and things will be adjusted according to how the body reacts. But it will not do any harm. Okay?
Yeah.
Oh, yes.
Full belief, definitely.
Leukemia patient, early stage.
Early stage leukemia. Child,
11.
fortunately, some types of leukemia today are curable. I don't know what type this person has. I'm sure treatment is ongoing, isn't it? Now, in leukemia,
This one EML, aggressive, the aggressive one.
acute myeloid leukemia, that one susah. Okay. Yeah, it can go very fast. That's why they call it acute. It can, how old?
11.
This now, acute myeloid leukemia, that one, what happens here is the white blood cells become cancerous. What is cancer? Cells dividing without control. That's cancer. It can be anywhere. There are more than 200 different types of cancer. Cancer is not one disease. 200 different types. This is one type. White blood cell. When anything multiplies fast, it uses up your resources. Okay? When it uses up all the resources, the normal cells do not get what they are supposed to get. So the body to fight back itself becomes very difficult. Okay? And a sick child is not able to eat more to supply that. One way of doing that would be to take a supplement in concentrated form. The nutrients from food in concentrated form will support the child. This will not cure the leukemia, the medication and all that, and depends on the luck of how the body responds. But it will definitely contribute to the strength of the body to try and fight that. Start slowly, half glass, once a day, half glass, twice a day, half glass, 3 times a day, spread it out. Yes.
Can I suggest Vemma to a patient with chronic kidney disease with no urine output and not on dialysis?
Not on dialysis.
And with no urine output also?
No urine output, not on dialysis. Peritoneal dialysis?
Also not started.
No. Oh, okay. Now, someone who has kidney failure cannot pass urine, hasn't gone on to dialysis, so they are in the process of being evaluated and treated. Usually someone who has reached that stage, at least they have to do peritoneal dialysis. So they're just about holding on. There's just enough kidney function to keep them going. Not for long. They will go into dialysis, or if they are lucky, if the condition resolves, they can escape dialysis. Okay? Now this will last only a short period. This is the time the outcome is not known. Don't go into that. Because, this is, to tell you frankly, this would be helpful. Very helpful. But, this is the time they are waiting for something to happen or not happen. And it's critical. And if the wrong thing happens, you will be blamed. So there is a social risk there.
You need to say that we cannot simply introduce.
That's right, yeah. Someone who's, very critical period now. It could be this way or that way.
Dead or alive.
How to avoid that?
How about obesity? Because there are some case person who took Vemma, then their weight is reduced. Their weight then reduced because after they took Vemma, they claim that Vemma have a direct effect to their obesity. Then I want to know more about the effect on their obesity.
Obesity.
Okay, thank you.
Now, Vemma is not a weight loss product. Okay? Having said that, sometimes, okay, when there is a lack of certain nutrition in the body, when there's a lack, we just want to keep on eating. The body creates the hunger for the nutrition that's missing. So it won't tell you, I need potassium, I need iron. So you just feel hungry, you just go on eating, see? So when you take a product that's that complete, when that is satisfied, the urge to eat comes down automatically. Number one. Number two, the antioxidants found here will help you to lose excess body weight if you're already trying to lose body weight. If you're just sitting, no, you won't. Let's say you're doing some walking exercise, somehow not moving, antioxidants will help you with that. So though we cannot claim that it is a weight loss product, we can tell members that this product will set many things in the body right. And if it happens to be your weight area, you are a gainer. Untung lah. Any other concerns? Yes.
we know that Vemma has put back our imbalance of our body, right, to back to a correct way. Okay, for example, like myself, first time I use Vemma, okay, before I use Vemma, I ada tapak kaki tu macam rasa sakit, you know, tidak, our tapak kaki, bukan sakit, that kalau kita step on, dia rasa macam ada nanah, you know, dia rasa sakit, very painful lah. Okay, after 1 week taking Vemma, and then the pain gone off, you know. So I feel something, wow, Vemma is very good. Okay, it helped me a lot lah. And then another thing I experienced while I got my shoulder, frozen shoulder. Okay, taking Vemma, it helps me to reduce the pain, you know. But eventually, one after another coming out, you know. I rasa macam start sakit belakang, you know. Start sakit belakang, you know. Tapi bila take Vemma, then the thing go off. Tapi one after another coming. Is it because they detect all the, bad thing in saying that I'm not healthy lah? Is it true?
Yes. When we fall sick,
Malaysia got
not sick, you see, many things in
only
life.
front, only front.
About 10% of the people are sick enough to be admitted. 10% of the people have no complaints.
Back in front.
The remaining 80%, not sick, but not healthy also. Perut sehat, you know, all kinds of problems, poor digestion, selalu headache, tidur tak lena, all kinds of, these are problems. You know. So after a while, the body will learn how to live with it and we don't complain. So, for example, backache. Then we learn to walk in a particular way so that it's not painful. We get used to that, you see. So, when you get better with either a product or a program or exercise or whatever, when your body gets better, what was now not so obvious will become more obvious. Okay? Which is good. It is being uncovered. Because long term, some of them can produce serious problems if you don't address it. So if something like that keeps being uncovered, you can deal with it. Now, having said that, don't forget, if there's any pain, anything that comes up, check and make sure it's not something else, new. Don't think that, oh, last time also backache, now also backache, same thing. No, it may be different. So check that out. But yes, this can happen. Uncovering of old symptoms that can come up. One last question. Yes.
Yes, doctor. I have a question. If a kidney patient that is on dialysis, the three things they cannot consume, which is potassium, sodium, and phosphate. And if you look at the back of the bottle, this product contains potassium. So if let's say we want to introduce this product to a patient, what are the best things for them in order to control the potassium level?
Oh yeah.
Now, kidney patients are told don't take fruits and vegetables. Okay? Why? They cannot put out potassium, which is found in fruits and vegetables, particularly fruits. Okay? So when I was working in the kidney ward, we tell the patient, don't take fruits. If you take fruits, 6 hours, 8 hours later, fluid will accumulate in the lungs, cannot breathe. Okay? Then we go off, when visiting time comes, relative and friends all bringing fruits. Then they also don't want to say no. And then they tell them, and I've heard this while sitting in the ward, in the room, I can hear it. No, doctor said, doctor kata tak boleh makan buah-buahan. Doctor cakap saja, tak boleh makan sikit. Yeah, got sikit. Once they start. And you know what? The effect will come about 8 hours later, 2 o'clock in the morning when you're sleeping, suddenly call, patient cannot breathe. The whole night for us is gone. Have to go there, dialyze them. Okay? So potassium, which is in fruits, it's not the fruits, the potassium in the fruits. Okay? Now, the potassium is necessary for the body to function. It's only extra potassium with regards to the patient's ability to throw out extra. Okay? What we have here is the right amount, in fact, a little lower than that, that is needed for the normal functioning of the body. So this will not add to their potassium or sodium load if they are strict to the fruits. But be careful, if the guy might eat a lot of fruits and say, I took Vemma, that's why I can't breathe. No, this doesn't have much potassium. Just enough for the body muscles to function. Now the potassium in fruits will be very high in banana, grapes, orange, and grapes and orange is the one that people bring in, as present. They don't bring banana.
So cannot bring anything.
So so this is okay.
Bring money.
That's right. 1 dose a day, enough. Okay.
2 ounce.
Yeah, one helping, 1 serving. Yeah. I want to thank all of you for being patient for so long, and thank you very much.